Good afternoon, ladies and gentlemen. I guess I'm here for two reasons. First of all, because we are a Pakistani startup who came out of Pakistan and expanded to be a regional player in the Middle East. And secondly, I think health technology is too serious a subject to be left to men alone. And that is the only reason why I'm here. When I look at the room around and the people around, I hardly see any women. So then I have to come out and stand for all those women who have the potential to come in front and show the capacities they have. So keeping jokes aside, the reason why I'm really here is because APPNA was the one who put in the first check in our company called MedIQ. So what is MedIQ? MedIQ is a platform ecosystem which is connecting health service providers, patients, and peers through its enterprise-level hybrid healthcare system. It's the smart healthcare, where people can choose between virtual care or physical care and interconnected by the interoperable electronic medical record. And why is it needed? We strongly believe that the healthcare should be accessible to everyone, and it can only be done if we can move the healthcare forward through technology which is scalable and at the same time sustainable as well for the countries like Pakistan. So if you look at what's the problem we are trying to solve. So in a country like Pakistan, where 50% of the people don't have access to healthcare system, and at the same time 80% of the hospitals are filled with the patients who do not require to be there, and the healthcare cost is very high, expensive, fragmented. So what if we keep those keep those patients out of the hospitals and treat them at home, while at the same time only bring them to the hospital when needed? So this is the side of the story which is in the emerging markets. But why we expanded to KSA? It seems like complete contrast. But it's the flip side of the same coin. Because if you look at the KSA market, it's a very high cost market where people are overutilizing the healthcare services. Despite spending a high percentage of the GDP on the healthcare, the system is still as fragmented as it is in Pakistan, because the primary healthcare, secondary healthcare, the tertiary healthcare is not connected at all. So how did we start? We started as a B2B play, where we were providing white label technology solutions to all those healthcare service providers, like insurance companies, hospitals, who wanted to provide virtual care to their large pool of customers. So we gave them the technology, the health service providers on top of it, and our engineering team, which used our plug-and-play technology to support them in providing services to millions of customers they have. But soon after COVID, we evolved into a platform ecosystem which was providing hybrid healthcare. So it's not easy to do so because it requires a lot of digitization and a lot of integration of the technology, and it has to work like a well-oiled machine. So it's because of the digital capacities we have that we are able to connect health service providers with the patients. Patients can use healthcare services in a hybrid manner. The money coming in from the payer can be an insurance company, it can be a corporate, it can be a large company like a telecom provider. So we are acting as like the bridge between all three P's of the healthcare system. As a result of it, the patients not only get the healthcare service they need, it's more patient-centered. We are getting a lot of data which will help us in the next stage of our evolution, which is like developing the predictive models. And then what we are getting is the financial data as well. While we were trying to digitize the whole system, we realized that many of our partners needed to be digitized. So we developed the software for them as well. So we are actually solving the problem for three of our partners. For patients, it's the patient-centric care. For the providers, it's getting the healthcare they want to provide in an easy way. And for the insurance companies, it's cheaper healthcare at the lower cost of the healthcare services. So this is how we make revenue. So we make revenue through health service provision and through our technology. And since we started providing technology, so our technology is being used in more than 7 countries now. We started our journey in Pakistan, and a population which is like 50%, having 50% non-accessible healthcare, but having technology or like having internet to 90% of the population. Any service which provides healthcare through technology can be easily used by those people. So it was a success factor for us. Since our inception, you can see the numbers. So our GMV is in 2023 was $23.8 million US dollars, and we made a revenue of $3.68 million. In addition, we had a healthcare conference without a healthcare incident. ऐसा हो नहीं सकता. So I didn't know that I'll be the one who will be creating that incident today, but that's fine. So yeah, so we were talking about, starting as a virtual care company, we evolved into a hybrid care platform. And because thanks to our non-digitized health service providers, we had to develop the softwares which made our processes more efficient, and we were able to sell those softwares abroad in different countries. So as a result of it, while we were developing services and technology for ourselves, we were at the same time creating another revenue line for us, that is selling software outside the countries to different countries where they were being needed. Anyways, so the idea of connecting all the three P's of healthcare system actually helped us in developing a technology platform which was according to the international standards. It's HIPAA compliant, high trust, it has certifications. We are now going for GDPR compliance. And as a result of this, we were able to expand to other markets like Saudi Arabia last year. And we had a very little difficulty in expanding to that market because most of the regulations which is required in Saudi Arabia was already fulfilled by us. So yeah, how do we earn revenues? I think it was already discussed that we have our technology platform which generates the revenue as a white label solution, and then we have a services layer on top of it through which we earn the revenues where we are present physically, while in other countries we have through our white label solutions which is providing the revenue for us. And by having, multiple revenue streams, and rather than focusing on one simple revenue stream, we have been able to generate volumes which are quite big enough that अगर मैं US में होती तो शायद मेरी valuation इस वक्त 100 million पे हो चुकी हुई होती. But being a Pakistani company and coming from Pakistan, so we are right now valued at $30 million US dollars in 2 years time period. So when APPNA invested in us, it was actually at a valuation of 5 million, and now we are raising at a valuation of $30 million US dollars within 2 years. So our annual, as you can see, the GMV last year, the gross merchandise value is 23.8 million, and we made revenues in 3.68 million US dollars. So thinking that startup is only about burning, if you have a use case like healthcare, where without giving discounts, you can actually add value and serve the customers in a more efficient manner, you do make money, and at the same time you can grow your business much larger. This year, even in the first half of the year, we have generated GMV of 24.6 million. In less than half a year, we have generated more revenue than the last year, and we are having 3.1 million US dollars as the profits. We are already cash flow positive in Pakistan, and we expanded to Saudi Arabia with the help of the revenues which we generated in Pakistan. And recently we are now raising our Series A for expansion in the Saudi market, so that from there we can go to the rest of the GCC market. I guess in Pakistan, we are partnered with all of the insurance companies, so we are their OPD partner, serving all of their clients, in addition to the major telecom industry partners and large corporates like Bestway, 4G Group, even like, companies like Huawei, Daraz, all of the employees are served by us. So because I think another reason of our success is that instead of focusing on B2C, we focus mainly on B2B and B2C model of expansion, which increases the stickiness and brings us the bulk of the customers from platforms who already have a large number of customers on them. Compared to our competitors who are only focusing on the services, we are a unique combination of technology and the services. The team, which is with me, are the ones who are devoted like me. Right from the beginning of this whole startup, I left my job as अभी मुझे मिले थे CEO of Sehat Sahulat Program. So I was the founding CEO of Sehat Sahulat Program after coming back from University of Yorkshire. So I left my job as a CEO and started this company out of my own pocket. Actually, I used my daughter's university fee to start this company. And it was like somebody asked me, what would you do if your daughter doesn't get the admission, or if you can't pay the university fee for her later on? She's not going to let you live your life so easily. I said, I'm a strong believer of this product. And luckily, the business grew and she got the scholarship. So now she's at Georgia Tech final year, planning to add the AI and ML component to this whole product. And the second one, my younger daughter, she just joined Georgia Tech, planning to be a data scientist and working in the healthcare sector. So I guess when कहते हैं जब नियत साफ हो तो चीज़ें भी आसान हो जाती हैं. So here is the team which has been with us right from the beginning. They are still with us, and these are the ones who are adding all the value to the work which we are doing. And this is what took us to Saudi Arabia, which proved us to be even a better market for us because it was ready for digitization. There's a strong push from the government to move the healthcare from the public sector towards the private sector with 100% digitization of the healthcare system. So MedIQ is the right service for that market. And they have a strategy, and out of that healthcare strategy, which they have developed for Vision 2030, out of the 7 priority areas, we are already fulfilling 4 out of the 7 areas. So this means that it's the right market to expand. And from there, if you go to the GCC market, this means you have already proven yourself in the biggest market of the GCC. Already established our company there, and this year we have generated about $1.7 million in terms of GMV and about $400,000 as the gross profit in the first 6 months of the year. We have 8 team members on the ground and we are expanding, and we are currently raising $3 million at the valuation of $27 million pre-money. So the total valuation is $30 million post-money for our Series A funding to expand our business in Saudi Arabia and from there to the rest of the GCC market. These are some of our partners we are working with, and you can see there is a gradual increase in the revenue from KSA, the team which is there, and basically we will be using this money for growth and expansion in Saudi Arabia. And we strongly believe that because of our advanced technology stack, subject matter expertise, and on-ground presence, we will be rapidly able to expand in Saudi Arabia and the GCC market. So I request you to be a part of MedIQ, because we are not imagining a better healthcare, we are actually doing it. Thank you.